Hello, and welcome to today's webinar, Allies in AI, Viz.ai and Microsoft Cloud for Healthcare Partnership Spotlight. We're excited to have you join us today as we explore how AI is revolutionizing care delivery, enhancing clinical workflows, and driving better patient outcomes. I'm Megan Forchetti, Senior Performance Marketing Manager at Viz.ai, and I'm so glad you could make the time to join us today. I'm excited to introduce to you our featured speakers that we have joining us today. Tanya Slauson, Vice President of Sales, Precision Imaging Network, part of Microsoft Cloud for Healthcare. Rebecca Carl, Senior Manager, Commercial Marketing and Partnerships at Viz.ai. Andrei Cesarski, Vice President, Strategic Growth and Customer Success at Viz.ai. And Justin Rye, Director of Product Management at Viz.ai. And with that, I will pass it over to Andre to get us started.
Thanks, Megan. So as of today in this webinar, the FDA has authorized over 1,000 AI-enabled medical devices, with over 700 of those dedicated to imaging. And that's an increase of over 300 in just the last year. So this surge reflects the rapid adoption of artificial intelligence in healthcare, with projections indicating that the number of AI-authorized devices will surpass 1,000 by the end of this year. While this proliferation offers immense potential, it also presents substantial challenges. Each new AI solution comes with its own platform, its own workflow, and integration requirements. This diversity means that IT departments are inundated with requests to support multiple systems, each necessitating unique infrastructure and security considerations. Purchasing teams face the daunting task of negotiating separate contracts for each vendor, leading to inefficiencies, increased administrative burdens. Security teams are also tasked with assessing and mitigating risks across multitude of platforms, each introducing potential vulnerabilities without offering economies of scale. The fragmentation of these platforms not only strains internal resources, but also introduces unnecessary security risks, complicating rather than simplifying patient care. This complex landscape underscores the need for a unified approach. And that brings us today to today's webinar, where we'll explore the partnership between Microsoft and Viz.ai. Together, we offer the broadest AI marketplace integrated with a leading care coordination platform, delivering a single infrastructure to meet your AI imaging needs. This collaboration leverages existing business relationships, data agreements, security protocols, and infrastructures that many healthcare organizations already have in place, aiming to streamline operations and enhance patient care. So when we look at this slide, this is just a broad overview of Viz. Where are we today and why did we come to this partnership? So when we're looking at us today, there are 50,000 registered users across multiple disciplines. We have over 1,700 sites where Viz is installed. And when we look at our alerts, 90% of our alerts are being viewed in under 5 minutes. That essentially means that we're actively being used in every institution that we're installed. We're in some of the largest healthcare systems and IDNs in the country, and we have proven outcomes with a multitude of publications showing increased patient benefits, decreased length of stay, reduced disability, and we're also considered a leader in this space. It's our de novo approval that was granted to us in 2018 that created the CAD-T or triage FDA indication that we use and that most of our competitors 510K and bring to market. So when we look at our platform, if you're not familiar with us, what do we do? Essentially, we ingest healthcare data to our cloud. In most cases, it's in a DICOM format, and it could be imaging, could be EHR data. We bring that data to our cloud, we'll run algorithms over that data, and we will find certain pathologies, diseases, and based on the conditions that we find, we use AI to alert the relevant care team based on where that patient is, And that enables the care team to put them on a care pathway and get them to guideline therapy. So that's the basic overview here. Okay. Rebecca, I'll hand it over to you.
Thanks, Andre. So with that, we're excited to now present the value of the partnership and everything that Viz has done within our customer base and providing better patient outcomes, and now what that can do for organizations with the Microsoft partnership. As a bit of background, Viz and Microsoft officially entered this agreement just before Thanksgiving this past November. It was announced through press releases, email communications, and social posts, as well as trade show conferences. The partnership represents a thorough evaluation by both providers to consider the limitations, just like Andre mentioned, that healthcare organizations are facing when it comes to enabling those new technologies, specifically in this case, the best of breed image-based AI. So during that introduction, the goals were to alleviate now the biggest pain points of accelerating AI adoption while reducing the single vendor requests, the integrations, the infrastructure, the contracting to enable clinicians while also decreasing the administrative burden and the IT and security processes there. Previously, organizations were presented with just 3 options whenever evaluating some of the AI in the market. Point solutions, which were seen as more narrow and niche, marketplaces not often tied to workflow, and various platforms that were limited in scope of what they could accomplish for disease states. Together with Microsoft, as you can see in that middle column, Viz now combines a true marketplace with a vendor that's heavily established in its footprint and pairs that with our dedicated platform inclusive of specialist care coordination and imaging workflow. This allows sites to utilize AI across many more disease states, reduces the integration points and infrastructure necessary to implement, and streamlines the processes through Viz and Microsoft security and contracting, while not foregoing any of the niche-like tools for individual providers and specialty teams. So ultimately, in that last column, you can see that imaging departments and providers are now able to more efficiently incorporate and accelerate their adoption of AI initiatives. Specialty teams can take advantage of those customized alerts and communication tools, and IT and security teams have a more streamlined process, all while working towards that goal of better patient outcomes. With this next view, there is just a peek into seeing how this represents those multiple vendors that are now part of this ecosystem with Microsoft and Viz.ai. The Viz solutions are represented in the bold blue font here, while the other disease states are supported through the Microsoft collaboration. Viz, of course, was a pioneer in stroke triage and alerts, but has continued to grow its platform to include other time-sensitive disease pathologies, inclusive of aneurysm, hemorrhage, pulmonary embolism, and aortic aneurysm and dissection, among others that you can see, while pairing that with workflow and care coordination. The burden of imaging providers, though, is to quickly interact with those care teams for these acute diseases, but also include any incidental or additional findings in their report that the patient should be treated for once stabilized. So as you can see in that middle column, Microsoft includes many vendors that support the opportunistic screening, and even additionally in that first column that Viz did not natively support. The addition of this AI to support radiologists in this regard helps reduce that cognitive burden and aid in follow-up as well as management. Unlike a more simple platform that in some cases, multiple vendors now are able to cover some of these disease spaces, so that with a true marketplace, now you have options that can better fit your individual organization needs as opposed to just having one vendor to select from. All of this, again, is paired to radiology workflow benefits within your PACS and reporting systems for imaging, as well as outside of imaging, utilizing consistent care coordination and communication channels to deliver those customized alerts on the pathways you choose to enable from this sheet. I'm now going to hand over to Justin Rae, who will demonstrate a little bit of the behind the scenes of what we're doing to accomplish what you see here before reviewing the end user benefits. Justin?
Thanks so much, Rebecca. So as Rebecca stated, we'll take a step back and look behind the scenes at what we're creating with the partnership between Viz.ai and Microsoft Cloud for healthcare. So today, imaging AI solutions must seamlessly integrate into the radiology workflow, ensuring results that are delivered where they provide the most value. Whether running within Microsoft's Precision Imaging Network, part of Microsoft's Cloud for Healthcare, or within Viz.ai, images will flow through a unified AI orchestrator, allowing for rapid processing and immediate delivery of results to Microsoft solutions like PowerScribe, Empower, Follow-up Manager, and Workflow Manager. At the same time, this architecture enables prioritization of radiology work lists from leading vendors such as Fuji, Change Healthcare, Meritive, and Sectra. By embedding AI results directly into PowerScribe, radiologists will save valuable time, while Empower provides analytics discordance reports, highlighting discrepancies between AI findings and radiology impressions. Importantly, regardless of whether an AI algorithm is provided by Viz.ai or Microsoft's Precision Imaging Network through partnerships, critical findings and referrals are automatically surfaced in the Viz Care Coordination platform, both on mobile and desktop applications. Our fully integrated ecosystem streamlines nearly all imaging AI workflows, making it significantly easier for health systems to onboard new AI algorithms as they become available, providing ease for IT, security, and purchasing teams. Now let's shift perspectives. What does this actually enable for radiologists and specialists in their day-to-day workflow? So regardless of the AI algorithm in use, radiologists and specialists benefit from a structured and efficient workflow. With this integration, radiologists gain a highly efficient workflow that prioritizes critical findings in their work list, ensuring incidental findings don't get overlooked, and embeds AI insights directly into their existing tools. With work list prioritization, AI-powered triage automatically flags urgent cases, pushing them to the top of radiologists' work lists. At the same time, the Viz desktop widget, which is the blue square on the lower left of the left-hand screen, enables direct communication with care teams and facilitates immediate care team activation. With PowerScribe integration, findings are seamlessly included in radiology reports, ensuring no additional manual entry is needed. And lastly, in the center, with PACS integration for AI-generated DICOM secondary captures and structured reports are available directly within the PACS for quick viewing and reference. Through this streamlined workflow, radiologists can focus on interpretation rather than administrative tasks. AI doesn't just assist in diagnosis, it ensures that findings translate into action. So what does this mean in practical terms? And we'll summarize again and come back to a slide Andre showed earlier. Well, the real world benefits to this approach are clear. A single AI orchestration channel instead of managing multiple vendor integrations. IT teams now can onboard AI models through a single pathway, reducing complexity. Seamless radiology workflow, AI findings are automatically incorporated into PowerScribe, into PACS, and radiology work lists, eliminating workflow disruption. Immediate care team awareness through the Viz coordination tools. Critical findings are now surfaced to care teams in real time, ensuring appropriate follow-up and treatment. And in general, efficiency gains across the board. Radiologists save time, care teams work more efficiently, and most importantly, patients receive the care that they need without delays. So at this point, I'm going to hand over to Tanya, who will dive a little deeper into how this partnership is making AI adoption even easier for health systems.
Thank you very much, Justin. As Andre mentioned earlier in the beginning of this webinar, the significant growth of FDA-cleared algorithms and many groundbreaking preclinical studies demonstrate the potential that AI can make in medical imaging, and it's only the beginning. But still, there could be significant practical barriers to smooth deployment and integration of AI technology into clinical practice. It's no exaggeration that hospital IT departments were facing considerable resource constraints even before AI applications drove this significant surge in demand. And the expected exponential increase in AI tools is positioned to further overwhelm the existing systems and personnel resources. Precision Imaging Network, on the other hand, is built on the Microsoft Azure infrastructure. It is utilizing your existing PowerShare image exchange infrastructure to deliver the scalability and security that enterprise-wide AI orchestration and system integration requires. If you are already utilizing Microsoft Azure, any solutions that are purchased through the Precision Imaging Network can decrement your commitment to your MAC agreement. The native capabilities of PowerScribe next generation reporting tools will help your radiologist achieve new levels of reporting efficiency, accuracy, and quality. As I mentioned earlier, PowerShare infrastructure is already in place in 85% of health systems across the country. As a result, the security reviews are complete, the BAAs are in place, we're utilizing a single contract. And last but not least, Empower Concordance Reporting and Analytics helps providers retrieve additional actionable information and derive insights from the data delivered into their systems. Precision Imaging Network is truly designed to complement and support hospital IT departments and provide cost-effective means for healthcare organizations to deploy and manage a wide array of complex AI tools across their large enterprises. And to give you kind of an example of what it truly means for a health system, this is an example of a large health system comparing an implementation of a traditional IT project that can take anywhere from 7 to 12 to 18 months, comparing it to their implementation of the Precision Imaging Network platform, with the first algorithm going live within less than 3 months and subsequent algorithms going live within less than a month and oftentimes within a matter of several days to a week. With this single point of access to a collection of third-party AI models, Precision Imaging Network really facilitates a scalable, efficient AI model deployment in a short period of time without straining valuable organizational resources. This robust infrastructure of Precision Imaging Network is one of many Microsoft's contributions. Small point solutions, other niche AI platforms can face uncertainties in this day and age due to potential acquisitions, changes in ownership. But Microsoft is a reliable, long-established company that will offer our customers long-term stability, predictability, and access to these groundbreaking technologies. And our customers can truly rely on the Microsoft's commitment to innovation and have confidence in the relationship with the global technology leader. Our partnership with Viz is a big step in the commitment to bring the best of breed AI partners to our platform, and Microsoft's extensive technological resources, including AI and cloud solutions developed across various industries, can be adapted to healthcare delivery. We are very thrilled about this partnership and looking forward to meeting the ever-changing demands of healthcare in this day and age. I will pass it back to Rebecca.
Thank you, Tanya. So today, throughout the session, we've demonstrated how the collaboration between Microsoft and Viz addresses those critical challenges in healthcare with accelerating that AI adoption. This is done through reducing the IT complexity by consolidating the AI solutions into a unified platform. We alleviate the burden on IT departments, simplifying integration and maintenance processes. This is also streamlining the AI deployment. Our partnership enables seamless implementation of AI tools, reducing the need for multiple vendor negotiations and disparate system integrations. And then additionally, enhancing clinical impact with a cohesive infrastructure. AI insights are now more readily accessible, facilitating timely and informed clinical decisions that improve patient outcomes. We're excited to bring this integrated solution to the market and look forward to collaborating with healthcare organizations to fully realize the value of AI in clinical workflows. Our goal is to benefit patients and providers alike while also delivering positive financial outcomes for the hospitals we serve.